One of the most frequent questions I'm asked is how can I prevent recurrent urinary tract infections? Now, I've seen thousands of patients with this issue, and there are some very simple things that can help. So there's a difference between men and women, and this relates to the length of the urethra. Women have a shorter urethra or water pipe, and men it's longer, so they're less likely to get infections. This means in men there's usually an underlying cause, but in women often there's not. So we have a fairly standard approach to this. We ask you lots of questions about your infections, we examine you, look at any cultures that have grown, and we would look at doing some imaging to exclude any surgically treatable cause. Now, we know that these urine infections are miserable and they can absolutely rule your life. And if you suffer with these, you know a lot about antibiotics. There's different ways of taking antibiotics. So you can take them in response to an infection, you can take them what we call prophylactically. So that's taking one every night to try and prevent an infection. You can keep a supply at home and start it when you feel those symptoms coming on. Or if things like intercourse are a trigger, you can take it after intercourse to try and prevent them. Now, the thing we know about antibiotics, and it's in the guidelines, but it's wrong, is that for patients with recurrent infections, 3 days is not enough. You should be having at least 7 or 10 days to make sure you clear your infection. If you've been through the menopause and you're suffering with infections, topical vaginal estrogen creams have been repeatedly shown to be effective. So speak to your GP or urologist about those. Things you can buy over the counter, like D-mannose tablets or cranberry tablets, or even cranberry juice if you don't mind the taste of it, can help prevent infections. Now, there's a medication called Hiprex, which is actually quite an old medication, but really is coming very much back into fashion for treating recurrent infections. We know that this causes the urine to become more acid, and it actually forms ammonia and formaldehyde in the urine. Now, these are not antibiotics, but they do prevent those bugs growing. And for patients who are just troubled by those infections all the time, it can tip the balance in their favor. If you find that these measures are not helping, please go and see a specialist, because we have lots of other treatments available. And we know what a miserable condition this can be. Don't suffer in silence. Thank you very much for watching. If you think anybody else might find this video useful, feel free to share it with them. Subscribe or follow for more content like this, and I'll see you next time.